I would like to show you today presentation about two topics: features different periods of the byte and TIS notation systems. In human's life, there are three periods of bytes formation. It is temporary byte period, variable byte period, and permanent byte period. What does it mean? Let's talk about temporary byte period. Temporary period has next features. At first, timing. Temporary byte period begins at the age of 6 months and its duration is till 6 years. What is starting point of this period? Starting point of this period is eruption of first lower temporary incisor at the age of 6 months, and this period ending with eruption of first permanent molar at the age of 6 years old. What features of this period? First one, in oral cavity are present only temporary teeth. Second feature, quantity. In oral cavity are present 20 teeth. Third feature, groups of teeth. There are three groups of teeth: incisors, canines, and temporary molars. In temporary byte period, there are no group of teeth like premolars, only incisors, canines, and molars. Group of premolars is absent. Then, it is very important to know about sequence of this eruption. First tooth is erupted, lower central incisor. Then, or tooth number 1, then is erupted second lateral incisor. Then tooth number 4, first temporary molar, then temporary canine, then second temporary molar. It is very easy to mention, to remember it. Please remember it like poem: 1, 2, 4, 3, 5. 1, 2, 4, 3, 5. Once again. 1, 2, 4, 3, 5. In temporary byte period, I divide three periods: formation period, stabilization period, and aging period. How these periods are distributed in age from 6 months till 6 years. First period, formation period, from 6 months till 2.5 years old. And what features are in this period? First of all, to erupt temporary teeth, we need more volume of the bone because alveolar process is growing. And then temporary teeth eruption. The volume of oral cavity increases because of teeth are erupted and height of bite is increased too. The branch of the lower jaw acquires a more vertical position. Instead of in newborns, the branch of the lower jaw has a more horizontal position. The articular disc becomes biconcave instead of flat articular disc before teeth eruption. The curvature of the articular head increases. The joint fossa deepens. And somatic type of swallowing formation. As you know, in newborn, the infantile type of swallowing, when tip of tongue pushes into lips. But after eruption of teeth, tip of tongue push into oral surface of teeth, and it's called somatic type of swallowing. With the eruption of all 20 temporary teeth, the first stage of the physiological rise of bite height occurs. First stage of physiological rise of bite. Second period of temporary bite, stabilization. Duration of this period from 2.5 years till 4 years old. And what signs of this period? Alveolar process growing. The volume of oral cavity increases. The same signs with branch of lower jaw, with articular disc, the curvature of articular head, and the same is happening with joint fossa and somatic type of swallowing formation. So the same signs like in formation bite period, but what differences? Root formation of temporary teeth ends. And more pronounced oral and chewing muscles function. due to child begins to chew. And third period of temporary bite called aging. It is period from 4 till 6 years old. And what features of this period? Direct contact of the incisors is established in the frontal area. We will observe three physiological features. First one, physiological diastemas and tremors, gaps between teeth in one dental row, physiological tremors and diastemas, physiological resorption of incisor roots, and as a result of physiological resorption, during our clinical examination, we will observe physiological teeth mobility. Moreover, we will observe abrasion of the cutting edges of the incisors and chewing tubercles of the lateral teeth. And as a result, medial displacement of the lower jaw. The distal surfaces of the second temporary molars form a retromolar plane or ledge, the so-called sagittal step, Zielinski's symptom. It is prognostic symptom, and this symptom used to prognose formation of normal bite or pathological bite. And of course, due to abrasion of the teeth, decrease in the crown's height. And the differentiation of the elements of the temporomandibular joints is completed. Next period of the bite, variable bite period. What does it mean? Features of this period: from 6 years old till 12 years old. Start point: eruption of first permanent molar. As usual, it is lower first permanent molar. And finishing point: fallout of last temporary tooth. In oral cavity are present temporary and permanent teeth at one time. What about sequence of eruption? Sequence of eruption of permanent teeth. Sequence of eruption of permanent teeth is the same like in temporary dentition, but at the beginning we need at 6 and at the end we add 7. the same poem. 6, 1, 2, 4, 3, 5, 7. 6, 1, 2, 4, 3, 5, 7. And permanent byte period. What features of permanent byte period? Age from 13 years old and till all further life, or maybe till Fallout last permanent use. Start point eruption of second permanent molar. Endpoint fallout of last permanent tooth. And in oral cavity we will observe only permanent teeth presence. And let's summarize, doctors. Take home message. What periods? Temporary, bite period, age 6 months, 6 years, 20 teeth and without group of premolars. Variable bite period, age 6 years old, 12 years old, in oral cavity are present temporary and permanent teeth at one time. Variable bite period divides into two subperiods. And now let's talk about teeth notation systems. First one is Palmer tooth notation system. Palmer notation, named after Ohio dentist Dr. Corydon Palmer, is a dental notation used by dentists to associate information to a specific tooth, also known as the military system. Although supposedly superseded by the FDI World Dental Federation notation, it overwhelmingly continues to be the preferred method used by orthodontists, dental students and practitioners in the United Kingdom. It was originally termed the Zsigmondy system after the Hungarian dentist Adolf Zsigmondy, who developed the idea in 1861, using a Zsigmondy cross to record quadrants of tooth positions. Adult teeth were numbered 1 to 8, and the child primary dentition, also called deciduous, milk or baby teeth, were depicted with a quadrant grid using Roman numerals 1, 2, 3, 4, 5 to number the teeth from the midline. But Palmer changed this to A, B, C, D, E. This makes it less confusing and less prone to errors in interpretation. The Palmer notation consists of symbols like this one, designating in which quadrant the tooth is found and the number indicating the position from the midline. Adult teeth are numbered 1 to 8, with deciduous baby teeth indicated by a letter A to E. Hence, the left and right maxillary central incisor would have the same number 1, but the right one would have the symbol like this underneath it, while the left one would have another symbol. Please pay attention here. All dental roofs are divided into 4 quadrants. First, upper right half of dentition, 2 upper left, 3 lower left, and 4 lower right. Upper right teeth is depicted by this symbol. Upper left with this symbol. Lower left or third quadrant with this symbol. And lower right with this symbol. What does it mean? It means that upper right central incisor will be signed with this symbol and number 1. Upper left central incisor will be signed by this symbol and number 1. Lower left central incisor will marked like this symbol and number 1. Lower right central incisor will have symbol like this and number 1, 2. Moreover, upper right canine will marked like this. Upper left canine like this. Lower left first premolar will be marked like this. Lower right first premolar will be marked like here. And now please look at the short video about this notation, this tooth notation system.
Hi everyone, in this video I'll talk about the Palmer notation system. In this video I'll discuss the Palmer notation system for both the deciduous and the permanent dentations with examples. Palmer notation system is also referred as the Zygmundi system. In this notation system, we use alphabets for the deciduous teeth and we use numbers for the permanent teeth. The Palmer notation system consists of some symbols that we have to use together with the alphabets or number. For example, the first symbol, it indicates the maxillary right quadrant. The second symbol, it indicates the maxillary left quadrant. The third symbol, it indicates the mandibular right quadrant. And this one, the last one, it indicate the mandibular left quadrant. Now we will discuss the Palmer notation system for the deciduous dentition. In the Palmer notation system, we use capital alphabets that starts from the midline. This is A, that indicates the maxillary right central incisor, till E, that indicates the maxillary right second molar. Same alphabets are used in the left maxillary quadrant, and same alphabets are in the mandibular quadrant. So in order to identify individual tooth, we use these symbols together with the alphabets. This symbol indicates the maxillary right quadrant. The second symbol, it indicates the maxillary left quadrant. This third symbol, it indicates the mandibular left quadrant. And this symbol, it indicates the mandibular right quadrant together with each alphabets. Together with these alphabets, we use these symbols in order to identify, in order to represent each individual tooth. Now we will do some exercise on the deciduous dentition. So this is a complete deciduous dentition, 10 teeth in the upper arch and 10 in the lower arch. This red line, it indicates a midline. This is the right side and this is the left side. Now the maxillary right canine. This tooth is the maxillary right canine. So in the Palmer notation system, the alphabet that is used for this tooth is C. But this C is used with a symbol, and we use this symbol because it is the canine of the right side in the maxillary arch. Now, maxillary left second molar. This tooth is the maxillary left second molar. This is central incisor, lateral incisor, canine, first molar and the second molar. So for this tooth, we use, this tooth is A, B, C, D and E. So we will write E over here in the capital letters together with a symbol, and we will use this symbol. And this symbol indicates the maxillary arch of the left side. Now the mandibular right central incisor. This tooth is the mandibular right central incisor. So for the mandibular right central incisor, or for any of the central incisor, we use alphabet that is A. And A is for all the central incisor, but in order to distinguish it from the other central incisor, we use this symbol that indicate a mandibular arch, but a mandibular teeth of the right side. Now we will discuss the Palmer numbering system for the permanent dentation. So in the permanent dentation, each tooth is numbered, and the numbers, they start from the midline, from 1 to 8 in each arch. In the maxillary right side, the numbers start with 1 with the maxillary right central incisor till 8 for the maxillary right third molar. Similar is for the left maxillary arch. And similar numbers are given in the mandibular arch. 1 is for the mandibular left central incisor till 8, that is for the mandibular left third molar. So, in order to represent each arch, each quadrant, we use these symbols. That this symbol, it indicates the maxillary right quadrant. The second symbol, it indicates the maxillary left quadrant. This third symbol, it indicates the mandibular left quadrant, and this symbol indicates the mandibular right quadrant. Now we will do some exercise of the Palmer notation system on the palmar indentation. So this is the complete palmar indentation. This is the maxillary complete arch of the palmar teeth, and this is the complete mandibular teeth, palmar teeth. So there are 16 teeth in the upper arch. This is a set of 16 teeth, and the mandibular arch there are 16 teeth, 8 in each quadrant. This is one quadrant, this is the right maxillary quadrant, this is the left maxillary quadrant, this is the left mandibular, and this is the right mandibular quadrant. So there are 8 teeth in each quadrant, 16 in the complete maxillary arch and 16 in the mandibular arch. Now, the right maxillary central incisor, this is the maxillary arch and this is the maxillary right central incisor. So in the Palmer notation system, we give this tooth a number, and that number is number 1. And now 1 is used for every central incisor, whether it is in the maxillary arch or whether it is the mandibular central incisor. In order to distinguish it from the rest of the central incisor, we draw a symbol, and we use this symbol. And this it indicates that it is a central incisor. The 1 indicates a central incisor, and this symbol it indicates that it is of the maxillary right quadrant. It is the central incisor of the maxillary right quadrant. Now the left central incisor, this tooth is the left maxillary central incisor, and now we number it as 1 because the numbers start from the midline and we call it as number 1. Now, in order to distinguish it from the right side, we draw a symbol, and we draw this symbol that indicates that it is a central incisor, maxillary central incisor of the left side. Now, left mandibular first molar, this tooth is the left mandibular first molar. This is central incisor, lateral canine, first premolar, second premolar, and the first molar of the left side. Now, the number of this tooth will be, the numbers start from midline, 1, 2, 3, 4, 5, 6. So, we will write 6 over here. Now 6 is used for all the first molars. Now in order to distinguish it from the rest of the first molars on the maxillary and the mandibular arch of the other side, we will draw a symbol, and we draw this symbol that indicates that it is of the mandibular arch, and in the mandibular arch this tooth is on the left side. Now, it is very important that you should have an idea, or you should have a clear idea of an individual tooth morphology, because sometimes you have to number tooth in case of the deciduous dentition, in case of the mixed dentition, or in case of missing tooth. So, individual tooth morphology is very important in order to number a tooth. Thank you.
And this table is showed Palmer notation system for permanent Palmer notation system for permanent dentition and for primary dentition. Once again, feature of Palmer notation system for primary dentition is notation with not with numbers but with Latin big letters A, B, C, D, E. Palmer notation system for a normal adult, full set of teeth looks like on this slide. All upper right teeth need to mark with this symbol, upper left, with this symbol, lower left, with this symbol, lower right, with this symbol. But Palmer notation for a normal child full set of teeth looks like on this slide. And once again, notation with big Latin letters A, B, C, D, E. Next system, universal numbering system. The universal numbering system, also called the American system, is a dental notation system for associating information to a specific tooth commonly used in the United States. And now please look video about universal notation system.
In this video, I'll discuss the universal notation system for both the deciduous and the permanent dentations with examples. Universal notation system is also known as the American system. In universal notation system, each tooth has a unique alphabet in case of deciduous teeth or a number in case of the permanent teeth. Now, for the primary or the deciduous dentition, we use capital letters and it begins with the right maxillary second molar. It begins with the right second maxillary molar that we give it alphabet A till J for the left maxillary second molar. For the mandibular teeth, it begins with alphabet K in a clockwise manner. After J, it comes K for the mandibular left second molar till T, that is for the mandibular second molar of the right side. Now we will do some exercise of the universal notation system for the primary or the deciduous dentition. So this is a complete picture of a deciduous or a primary dentition. These are the maxillary teeth, these are the mandibular teeth. So there will be 10 teeth in a complete primary dentition in the upper arch and 10 teeth will be in the lower arch. This red line indicates a midline and this is the right side and this is the left side. So for the right maxillary first molar, this is the right maxillary first molar, this is the second molar. So for the right maxillary first molar, the notation in the universal notation system is alphabet B. So this is B, alphabet B for the right maxillary first molar, deciduous first molar. So it starts with alphabet A, B, C. So B is for the right maxillary first molar. Now for the next tooth, the left maxillary central incisor. This tooth is the left maxillary central incisor. For the left maxillary central incisor, the alphabet is F. In the capital letter. So B, after B it comes C, D, E and F. So this is for the left maxillary central incisor. Now we will do another exercise for the right mandibular second molar. This tooth is the right mandibular second molar. This tooth is the right mandibular second molar. This is the first molar, mandibular molar of the right side. This is the second. For this tooth, the alphabet in the universal numbering system will be T. Because here it comes J, K, L, M, N, O, P, Q, R, S and the last one is T. So this is the exercise for the primary or the deciduous dentition. Universal numbering system for the permanent dentition. The permanent teeth are numbered from 1 to 16 in the maxillary arch. So the number starts with 1 from the right side. This is the number for the maxillary third molar of the right side till 16 for the maxillary third molar of the left side. The numbering for the mandibular arch start from the left side and start from number 17. The numbers go in a clockwise direction. From 17 for the lower left third molar till 32 for the lower right third molar. Now we will do exercise of the universal numbering system on the permanent dentition. So this tooth is a right maxillary canine. This is a pointed tooth, that is a canine, and it's the right maxillary canine. So in the universal numbering system, this tooth is numbered as number 6. This tooth is numbered as number 6. Because the numbers start from 1, 2, 3, first molar, 4 for the premolar, second premolar, 5 for the maxillary first premolar, and 6 for the canine on the right side. Now, for the left maxillary first molar, this tooth is the left maxillary first molar. The number is 14. The number is 14 for the left maxillary first molar. After 6, 7, 8, 9, 10, 11, 12, 13 for the second premolar and 14 for the first molar of the right side, of the left side. Now left mandibular central incisor. This tooth is the left mandibular central incisor. Now in the universal numbering system, the number of this tooth is 24. So this tooth, the number is 24. And the 24 is 14, 15, 16, now in a clockwise direction, 17, 18, 19 for this tooth, 20 for the second premolar, 21 for the first premolar, 22 for the canine, 23 for the lateral incisor, and 24 for the central incisor of the left side. So, and 32 for this tooth, the right third molar, mandibular third molar. Now it is very important that whether you are using FDI, Palmer or the universal notation system, you must have a good understanding of the individual tooth morphology, because sometimes you have to number the teeth in case of mixed dentition, retained teeth or the congenitally missing teeth.
In this table, they are shown a universal numbering system for permanent dentition, primary dentition. As can you see, universal numbering system for permanent dentition begins from upper right third molar, upper right wisdom tooth, and numbered 1, and then numbering step by step. Upper right second molar has number 2, upper right first molar 3, and step by step clockwise. Upper right, upper left, lower right. Primary dentition in a universal numbering system is marking from capital letter A, upper right second temporary molar, upper right first temporary molar marked B, and then C, D, E, upper left part F, G, H, I, J, lower left part, lower left second temporary molar K, lower left first temporary molar L, lower left canine M, lower left lateral temporary incisor N, lower left central temporary incisor O, and lower right part. Lower right central incisor P, lower right lateral incisor Q, lower right temporary canine R, lower right temporary first molar S, and lower right second temporary molar T. But I would like you to know that the alternative system for primary dentition with numbers and small letters D. But the most widespread is this primary dentition notation system. In the rest of the world, a different international standard, ISO 3950 double point 2016 is used. What about FDI World Dental Federation notation? FDI World Dental Federation notation is a dental notation widely used by dentists internationally to associate information to a specific tooth. Developed by the FDI World Dental Federation, World Dental Federation notation is also known as ISO 3950 notation. Orientation of the chart is traditionally dentist's view. What does it mean? It means that patient's right corresponds to the notation chart left. The designation left and right of the chart below correspond to the patient's left and right. It is a screen from site ISO, International Standard Organization, and our dentist. This number system is called designation system for teeth and areas of the oral cavity. And this system, ISO 3950 2016, provides a system for designating teeth or areas of the oral cavity using 2 digits. Means number of quadrant. Upper right, upper left, number 3 lower left, number 4 lower right. But second number means number of tooth. Number 1, upper central incisor. Number 2, upper lateral incisor. Number 3, canine. Number 4, I'm sorry, it was mistake, not only upper. Number 1, it is all central incisors. Number 2, all lateral incisors. Number 3, all four canines. Number 4, all upper and lower right and left first premolars. Number 5, all 4 second premolars. Number 6, all 4 first molars. Number 7, all 4 second molars. Number 8, all 4 third molars. But to understand about upper or lower tooth and right or left halves, we use first number. For example, tooth number 3, 7, it means that third quadrant, lower left quadrant, and tooth number 7, second molar, or tooth number 44. I'm sorry, not 44, but 4, 4. Tooth number 4, 4. First number 4, it means fourth quadrant, lower right quadrant, and second number 4, it means that it is first premolar, or tooth number 31. Sorry, I made mistake again. 3, 1. Number 3 means a lower left quadrant, and number 1 means central incisor. Tooth number 3, 1, lower left central incisor.
Referred as the FDI notation system. In this video, I'll discuss the FDI notation system for both the deciduous and the permanent dentitions with examples. FDI notation system is also referred as ISO 3950 notation. The American Dental Association recommends this notation system since 1996. This notation system is adopted by the World Health Organization and International Association for Dental Research. Now we will discuss the FDI notation system for the deciduous dentition. Basically, the FDI notation system is a 2-digit notation system. This is a 2-digit notation system for both the maxillary and the mandibular arch. The numbers start from the midline: 5-1, 5-2, 5-3, 5-4, 6-1, 6-2, 6-3, 6-4, 6-5, and similar in the mandibular dentition. So the numbers start basically from the midline. There are 2 digits. The first digit, it basically indicates the quadrant number. For example, the number 5 indicate the maxillary right quadrant. Number 5 is the same for all of the teeth. Number 6 indicate the maxillary left quadrant. Number 7, it indicate the mandibular left, and number 8, it basically indicate the mandibular right quadrant. The second number, it basically represent the tooth number. It basically indicate the tooth number 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So these numbers are the same and they start from the midline. Now we will do some exercise of the FDI notation system on the deciduous dentition. Now this tooth is the maxillary right central incisor. So in the FDI notation system, the quadrant is referred as the maxillary right quadrant number is 5, and this central incisor is the number, this is the first tooth. So it is referred as 5-1. So this tooth is referred as 5-1. The maxillary left canine, this tooth is the maxillary left canine. This is the central, this is the lateral, and this is the canine. So the quadrant, the maxillary left quadrant is represented by a number, and that number is basically 6. And this tooth is the third tooth from the midline. So 1, 2, 3. So we will write 3. So this tooth is 6-3. So the maxillary left canine is 6-3. So we have to pronounce 6-3 instead of 63. So 6-3 is the correct pronunciation. Now the mandibular right first molar. This hole is a mandibular arch, and the mandibular right first molar, this tooth is the first molar. So mandibular right first molar, the quadrant number is, this quadrant is 7 and this quadrant is 8. So this is the 8th quadrant, and number is 1, 2, 3 and 4. So this tooth, the mandibular right first molar, is referred as 8-4 in the FDI notation system. Now we will discuss the FDI numbering system for the permanent dentition. Like the deciduous dentition, there are 2 digits, and the first digit, it basically indicates a quadrant. Number 1 is the maxillary right quadrant. The number 2, it is a maxillary left quadrant. Number 3, it is a mandibular left quadrant, and number 4 is the mandibular right quadrant. The second digit, it basically indicates the tooth number. So this is the second digit, and it basically indicates a tooth number 1, 2, 3, 4, 5, 6, 7, 8, and this is same for all of the arches. Now we will do some exercise of the FDI notation system for the permanent dentition. This is a complete permanent dentition, 16 teeth in the upper arch and 16 in the lower arch, in 8 in each quadrant. These are the 8 teeth and these are the 8 teeth. So maxillary right central incisor. This tooth is the maxillary right central incisor. In the FDI notation system, this quadrant is numbered as number 1. The maxillary right quadrant is given as number 1. And this tooth is the first tooth from the midline. We name it, number it as 1. So this tooth is pronounced as 1, 1, not 11. Now the maxillary left second molar. This tooth is the maxillary left second molar. This tooth. This is the first molar, this is the second molar. So this is the maxillary left second molar. And the quadrant number in the FDI notation system is number 2. Now this tooth is 1, 2, 3, 4, 5, 6 and 7. So this tooth is referred as 2, 7 in the FDI notation system. Now this is the third quadrant, mandibular left quadrant. It is referred as number 3, and this quadrant is given a number, that is number 4, that is a mandibular right quadrant. So number 4. Now the mandibular right third molar. This is the whole mandibular arch and mandibular right third molar. This is the first molar, second molar and the third molar. Now the number of this tooth, the quadrant number is 4, and the complete number of this tooth be 1, 2, 3, 4, 5, 6, 7, 8. So this tooth will be referred as 4, 8 in the FDI notation system. So this tooth is referred as 4, 8.
Okay. And now let's see at the table of FDI two-digit notation system. Principles of this system. The 4 quadrants: upper right, upper left, lower right, upper right quadrant. First number is 1, upper left quadrant first number is 2, lower left quadrant first number is 3, and patient's lower right quadrant is first number is 4. And every tooth marking with numbers according its number from middle line. Number 1, central incisor. Number 2, lateral incisor. Number 3, canine. Number 4, first premolar. Number 5, second premolar. Number 6, first molar. Number 7, a second molar. Number 8, third molar. Second numbers are the same for all 4 quadrants. But what about numbering with FDI two-digit notation system for deciduous teeth or baby teeth? Quadrants numbers are next after permanent teeth. Once again, in permanent teeth, quadrant numbers are 1, 2, 3, 4, but for temporary teeth 5, 6, 7, 8. And for example, tooth number 54, it means that it is upper right first molar. 73, lower left canine. I hope you understand.